Hi, everybody. We're back. My name's Amy Bauer, and I am a psychotherapist with over 35 years of experience. And I'm here today with my friend Buck, who I've known since I was in the seventh grade.
And
And
I'm
that was like
Buck.
50 years ago, I realized. So go ahead. Yeah.
That's true. I'm
Yeah.
Buck, and I've been in psychotherapy as a patient for most of my life since I was in fourth grade under psychiatric care, and currently have a new psychiatrist, newish, that I am seeing every 2 weeks for bipolar. The medication's actually working. I felt it yesterday. I noticed that my mood is pretty stabilized, which is what bipolar
Good.
is up and down.
Yeah.
So I'm feeling pretty good. Um, we're going to have our session, but first we're going to start with the dysfunction so that we can
Yeah.
laugh at. So, Amy, what was your dysfunction of the week?
Oh, this is the silliest thing. So I was trying to like say my dysfunction is about MS, and this one is not, but that's okay. So I went out for lunch with my friend a couple weeks ago, and like a couple of days later, I was cleaning out my purse and I couldn't find my wallet. And I thought, well, maybe I set it somewhere weird. I checked everywhere in the house, even places I knew it couldn't be. I checked anyway, and I couldn't find it. I called my friend who I went out for lunch with and asked her to check her car. Wasn't there. She checked all around. Looked in my husband's car because could have been in there. Wasn't in there. And I'm freaking out. I wasn't as freaked out as I could have been because I had taken my debit card to pay and I'd put it in my purse, but not in my wallet. And my friend had given me some money to pay me for her part, and I put that in my wallet, not in my purse and not my wallet. So I don't. So I wasn't as freaked out as I could have been, but there was like some money in there. There was like $100 bill or something in there that like an emergency thing. And so I finally thought, well, maybe I should call the restaurant. This is like a week and a half later. Maybe I should call where we went to lunch. And I called, and the guy said, I said, I lost my wallet. I know it's a very off chance, but can you check and see? And he said, well, let me look. And he came back and he said, okay, what kind of wallet is it? And I said, it's long and black, and it's like a rectangle shape, and my ID's in it, and I need it. And he said, uh huh. And I went, I think he has it. And he said, it's Kate Spade, which I just didn't want to say. I don't know why, but I just finally said, it's Kate Spade. And he said, oh, are you Amy? And I was like, oh my God, he has my wallet. And I thought, it's a happy ending. So this dysfunction was like, why didn't I call them first?
Yeah,
What kept me from waiting a week and a half to call
yeah,
the restaurant? And I think it was because there was part of me that said, if it's not there, then it really is gone. And if I check there and I find out it's not there, then I have to like really look at what I have to do to like replace all this stuff.
yeah, right.
and, and so I think that's what it was. But it was a happy ending. He had it, but the
Yeah.
dysfunction was like so just stupidly waiting. Procrastination.
Well, and you have to
Yeah.
replace your medical cards, you have to replace your
Right.
driver's license, you have to replace.
Yeah.
So if you lose it, it's like your life. I was
Yeah.
mugged in New York, and it's still,
It's a
it took me
pain in the
forever
neck.
to get the cards back, and I had to get the Canadian cards back so I could
Oh,
live in
golly.
Canada. That was the thing, to get that card back and to go to
Yeah.
now you can only go to the website, and the website wasn't working, so I had to get a lawyer to get through the red tape and to actually find someone who could actually do it, and I had to
Yeah.
pay the lawyer. They didn't
Ugh,
charge very much, but I still had to pay a lawyer
still.
to
Yeah.
get that card back.
Like
So,
it's like a double whammy. You lose the money
yeah,
that you might have had in your wallet, and you lose money because you have to pay to replace stuff. Oh,
yeah.
yeah.
And I looked for my wallet because I figured, they'll just toss the wallet. They'll just take the money out and
Yeah.
they'll just toss the wallet, and
Yeah.
I looked and looked and looked. It was in New York City. I looked everywhere. There's a little park near where, I was mugged, and I
Mhm.
looked through that whole park. I looked like a homeless person searching for crack or something, but I
Yeah.
was like, really looking, on the ground,
Yeah.
and because I
Yeah.
just wanted my IDs back.
Yeah.
So now I'm
Yep.
very careful to
I
keep
understand.
IDs out of my wallet, only
Yeah.
essential
That's
things.
very
Just,
smart.
you know, so
Yeah.
medical cards when I know that I'm going to the doctor because I don't want to have to replace them. So, yeah.
No.
My
Pain in the
dysfunction
neck.
of the week was my dysfunction is now that it's winter, it's
Yeah.
the putting on getting ready to go outside, which takes like, I don't know, 15, 20 minutes, because you have to put your boots on and you have to
Right.
put layers on, you have to put your coat
Yep.
on, you have to
And you
put
have
your
to find
hood
your
up so that you
gloves.
can put on your backpack, you know
Yep.
you have to have extra things in your backpack. So I go to the gym and I can't wear my shoes in the gym, the boots, so I have to bring shoes in my backpack, which makes my backpack big, which makes the zippers come undone sometimes. So it's the hat on, but I can't put the hat
Yep.
on till I put the backpack on because it'll take the hat off. You know what I
Right.
mean? And then when I get
Yes.
to the gym, I have to loosen, the laces. I have to take the
Yep.
boots off, but it's all wet where you take the boots off. So you have to put your tennis shoes on right there before you do
Yep.
anything else. So you have to put your tennis shoes on, then you put your boots on the drying rack, then you put your coat above your boots, and then you have to go into the dressing area. You have to remove the layers, right? It's just,
Mm-hmm.
you know, it's it,
Yep.
it's like you don't even want to go to the
I
gym.
I get it. Yeah. No,
You don't want to
it's
go
it's it's
outside.
just hard to get outside. Yeah, and I was saying to my husband too last night. I said, I really hate being too warm, and when I get too warm, then that's the worst. But
Right.
I really hate being too warm. But I really hate being cold worse. Even though my body works better in the cold, I just hate being cold. Sitting there
Yeah.
in the car going, I just want to get warm, and it
Yeah.
takes forever. And yeah, I just hate being cold too. That
Yeah.
doesn't help.
And I bought
So,
groceries yesterday, which I had to carry, which I didn't, I forgot to, I had frostbite. So
yeah,
my
yeah,
hands are really affected by it. And I didn't have gloves. I didn't bring gloves. It's like so much to remember
yeah,
when you
yeah,
go outside. So today it's supposed to
yeah.
snow like 8 inches here. And I'm like, I'm not going outside.
I'm not leaving. Yeah, I wouldn't either. I'd be
I'm
like,
not
yeah,
dealing with it.
canceling the rest of my day. Yeah. Not going anywhere, doing anything. It's true.
Well, I have an audition, a general audition for Ubisoft, which is a gaming company here.
Yeah, yeah,
So I got the script today, which was passcoded. That's another dysfunction, which you can't copy
yeah.
it because it's passcoded. So I had to type it up so that I can
Oh,
rehearse it,
God bless
you
America.
know.
Yeah,
So,
yeah.
but it's good actually for the memory to type it up. And,
That's
I
true.
did take
Yeah, yeah.
typing. So
It gets in your brain in different kind of ways.
yeah.
Yeah,
So I
yeah.
had to do that so that I can send it because I don't have a printer and there's no printer place around here. So I have to send it to my ex so he'll print it up so I can work on it at the gym because that's how I work. I work at the gym.
Mm,
So today I wanted to
yeah.
talk about how you're treated by medical staff, you
Yes.
know, the good and the
Yes.
bad. So I
Right.
was just in New Jersey because I had to go down because I had to be examined by a doctor. I'm in a lawsuit against this guy who hit me, who T-boned me while I was just sitting in traffic. I wasn't doing anything. He actually came through 2 lanes of traffic through a gap in the car to try to get in front of me, even though I wasn't moving. He thought we were going to move, and he just plowed right into my door. So I had neck, shoulder, and lower back injuries because I turned really fast because he hit me
Sure.
right in the door. So
Scary.
I
Yeah.
had to go through physical therapy. I got examined by different doctors. I had MRIs. I had epidurals. I went through this whole thing. Anyway, this is the doctor. I didn't know this, but he was the doctor for me, for the defense, for me,
Right.
for the
Right.
plaintiff. So
Yeah.
um, he just came in. It's a medical doctor for legal things. So I
Hmm.
didn't know what it was, and he just came in and he had this attitude, this whole thing of, you know, you're faking it or something. I don't know what his attitude was. And he was like, he put me through some tests for flexibility, range of motion, that kind of thing. And but then he got to this point where he asked me about a disability that I had had, like in 1998 when I was hit by a van as a pedestrian.
Hmm.
I had to have a plate. I had surgery to cut the bone down because my hand had been angled. So he had to cut the bone down. He had to re-break it, and because it was
Wow.
healed, he had to re-break it. He had to put a metal plate in there and a pin, and he did a really good job. He was the doctor who in New York did a lot of athletes. So he
Yeah.
did famous athletes. He did elbows and wrists.
Yeah.
That's what he did. So, and he was really horrible to me. He was really
Yeah.
horrible to me. I mean, after the surgery, he came in and I was in a lot of pain. And he
Right.
said, "So, how are you doing?" And I said, "Well, I'm in a lot of pain." And he goes, "Oh, you're such a baby." And
An asshole.
my friend Jim said, "Excuse me?" He goes, "What are you
Yeah.
being a baby about? Of course it's going to hurt." I said, "No, it really, really hurts." So, and
Yeah.
I said, "And there's a screw coming out. There was a screw coming out." And he had never told me, he'd never told me what he was going to do. So
Right.
I was surprised to
That's
see a
that's
screw coming out of my,
obnoxious.
yeah,
Yeah.
a
Me
screw.
too. I would have been too.
So eventually he said he prescribed morphine because it really, really, really hurt. You know, he had
Yeah.
cut the bone. So
Yeah.
anyway, he was really
Yeah.
horrible, but he did a good job. But this doctor in New Jersey put me through these tests, and he just had this attitude the whole time, you know?
That's the
And
weirdest
I said,
thing.
"This is
Yeah.
painful. This is painful. This is because I don't have the range of motion that I had. I can't do the
Right.
same things. My back freezes up now, which it didn't do before. It freezes up, and I'm on like the heating pad. I use Salon Paws. I use
Yeah.
Voltaren, for my back.
Whatever you can.
And
Yeah.
and he was just rude. So the next day I had to meet with one of the paralegals. And so
Yeah.
for and I said, "So this is the defense's doctor?" She said, "No, this is our doctor." And I said, "He was
Did
really, really rude. He was
yeah.
really rude." And she goes, "Really? I don't find him." I said, "He was really rude." I said, "I thought he was the defense's doctor." That's how
Yeah.
bad he was.
Trying to trip you up. Yeah.
Yeah, he just had this attitude. I can't really describe it, but he had this attitude. So I thought today we'd talk about, medical
Yeah.
care, like bedside
Yeah.
manner. You know,
Yeah.
I don't know what you've
Yeah.
experienced, but
Oh, a ton of stuff. Yeah. Yeah. I think doctors get this idea that like their medical degree and their pedigree and all their accomplishments are more important than how they actually come across to the patient. And like so that they and when they get a bad review, they don't understand it because they go, but I'm a great doctor, I know how to do all these great things. But that is a little bedside manner goes a little good bedside manner goes a very
yeah,
long way. It's sort of like I knew this guy who was a really, really good musician, great saxophone player, but he was an asshole. And so people would want to work with him in terms of like his musicality, but he was a jerk. And so a lot of times they would hire somebody who wasn't as good of a player because they were easier to work with.
right,
And it's the same with the doctor. I would rather have a doctor that's easier to work with and maybe doesn't have quite the expertise or didn't go to Harvard or whatever.
right,
But they listen to me and they talk to me as if I am intelligent and have a brain, you
right.
know, because I don't want doctors to talk down to me.
Yeah,
I'm just because I don't have a medical degree doesn't mean that I am not as smart as they are, you know?
right,
Like you can be just as intelligent and not be a doctor, you
right.
know.
And we're the
So
ones we're the ones that actually have the disease or the disability.
yeah,
We're the ones that are
and
actually experiencing it. They're not
yeah,
experiencing it. So
right,
we have one up on them. You
yeah,
know, we have
yeah.
an
You know your
understanding
body
that,
better than anybody else.
yeah,
Yeah,
we have an understanding that they don't have. And it's hard for
right.
them to, admit that they don't
Yeah.
fully understand it.
Oh
They
yeah,
understand it textbook wise and intellectually,
yeah.
but they don't really understand it, you
No,
know?
Yep. No, did we talk about the short coat doctors last week? I think we might have, or some
Yeah,
other time.
yeah,
But but with the short coat doctors, the brand new doctors, they come in and I think they kind of have a. I mean, I know there's a lot of them that don't have that like cockiness, but they come in with some cockiness, and they would be telling me like, okay, one time I was in the hospital for because I was like having an exacerbation of my my a flare up of the MS. And
right,
so this one doctor comes in and says, so we're going to give you a course of steroids. And I said, you're not, because I'm on something called Tysabri. And with Tysabri, you can't have their steroids because it increases your risk of getting this thing called PML. And they didn't know what PML was. I had to explain. It's progressive multifocal leukoencephalopathy. So it's quite a mouthful. So, but they didn't know as much as I did about MS. And when I
right,
talked to my neurologist, he said that's probably true. That they haven't gotten those specializations yet. They know they're learning things like physiology and chemistry of the body and stuff like that, but that doesn't mean that they understand dysfunctions yet.
right.
So
No, that's
yeah.
true. That's true.
Yeah.
Now I've had doctors who have, at teaching hospitals where I had alopecia. I used to have alopecia,
Yeah.
and I went into because I would get injections. I think they were injections of
Yeah.
cortisone or maybe not cortisone, but steroids.
Yeah.
Um, and so he brought in all these students, and he said, "Can And I had bald spots on my head. He said, "Can anybody tell me what this is?" And nobody said anything. My head was down, and I said, "Alopecia areata." And he
Yeah.
goes, "Who
Yeah.
said that?" And I said, "I
Yeah.
did." And he looked at the
Yeah.
students and he goes, "None of you knew that. You don't
Yeah.
know what that is." And he goes, "And
Right.
you want to be dermatologists." He
Yeah.
goes, he said,
Yeah.
"Get out."
Learn. Yeah.
No, he said, "Get out."
He said, "Get out." Oh
He
wow.
said, "Get out."
Because none of them knew.
None of
Well,
them
I
knew.
want, and some of them might have known, but they didn't want to be the one to say it because they didn't want to be wrong. And
I
I
don't
think
know.
that happens. Yeah.
But
I
he and I had a really good laugh while he
yeah.
was poking my head. Yeah.
Yeah.
He said, and they
That they
want to
didn't
be
know.
dermatologists, and they're at Columbia Presbyterian, one of the most prestigious hospitals in New York City. And he goes,
And
and
they
they
don't know
don't
what
know.
alopecia.
They don't know. Yeah.
Yeah. Well, they couldn't have even made a guess about it. I mean, because they could have just said male pattern blindness or baldness. I mean, I call it male. I do. I think male pattern blindness is something that all men have to, but it's because they can't find anything ever.
Oh,
Maybe present company included, but yeah.
yeah.
They anyway. But they could have even said that, and they didn't even say that.
Yeah.
They just didn't
And
know anything.
I've had like doctors who are cutting edge, like the doctor I have now, who is the leading researcher in Canada for HIV and
That's
liver. And she's just wonderful. She actually brought her kids to see a show of mine.
yeah. Oh,
It's
cool.
really wonderful. She's busy. She's only
Yeah.
here like 6 months out of the year, and then she's off researching. I've had great doctors, and I've had really, really bad doctors. Like I had a
Yeah.
doctor in New York who was from Yale, and he was an HIV
Hmm.
doctor, and he was new. He was a researcher, but he had no
Right.
idea how to talk how to
Right.
talk to
No
patients
bedside
and
manner at
deal with
all.
them,
Yeah.
you know. And I
That ought to
finally,
be a class. I mean, I don't know if it is maybe now, but I'm not sure it is.
well, yeah,
I
they're supposed to like deal with
it's supposed to.
patients in
Yeah.
hospitals and things like that, but he had no idea what he
No
was doing.
idea.
And I told him that the
Yeah.
medication was making me sick and that, I was having really bad diarrhea and stuff. And he said, "Well, you have to keep taking it." And I said, "I'm not going to take it." Because if you
Yeah.
start another medication, it might mutate. This is early. And I said, "Well," I said, "then it's going to mutate." I said, "Because
No.
I can't take this medication." I said, I can't walk out of my house because I don't
Yeah.
know if I'm going to have
When
an
you're gonna have to.
accident or if I'm going to
Yeah.
throw up or if I. So I
Yeah.
just finally said
It's
no.
quality
I
of
said,
life.
yeah.
Yeah.
And I told him, I said, "You're a terrible doctor." And
Yeah.
he said, "Why?" And I
Yeah.
said, "Because you have no idea how to talk to people." I said,
Yeah.
"You
And how
you
to
aren't
listen.
you aren't
Yeah.
HIV." And he goes, "No,
Yeah.
I'm not." And I said, "But you treat HIV people. Do you know anything about it? I mean, do you know what this medication does to people? Do you know how
Right.
people get depressed because they're HIV? Do you know how hard it is
Yeah.
to get a relationship? Do you know any of that stuff?" I said,
No.
"Because you are a doctor who treats people with HIV. There's it's
Yeah.
multifaceted."
He needs to understand not only the physical aspects of it and how and the the biology of it.
Right,
He needs to understand the emotional impact on people
right,
who have a chronic illness, you know because that's what any now and there were times where it was just like a fatal illness and you knew you were
yeah,
gonna but now it's like it's a chronic illness, but it's they need to understand like what are the implications of that for people,
right. Well,
and he
now the
doesn't.
medication is much better, and they know a
Right,
lot more.
right,
Back
yeah.
then, it was still kind of a
It's still a
mystery as to
death
where,
sentence.
you know,
Yeah,
but they
yeah,
weren't listening. A lot of them weren't listening to the patients. I
right,
mean, your medical condition is still kind of a mystery in many
yeah,
ways, and
yeah,
you have doctors that don't know, and
right,
think that they do know, and
yeah,
that this is the best
yeah,
course, and they don't really listen to you. Do you have that
right.
experience?
No, well, I've been really fortunate to have very good neurologists, and that's just been a fortunate thing. But yeah, I've had other doctors who just don't want to who want to poo poo it or don't want to. I know a lot of people who have MS who don't have a neurologist, and I really think that's a mistake unless there's no neurologist available, which I know that that's true a lot of places. But if you can get a specialist, because a lot of the GPs, they understand what it is, but they don't necessarily understand the subtleties of the different medications or like all the different ways that it can present. And so many people get misdiagnosed with other stuff like depression. People will say it's just depression or it's all in your head, which it is in reality, but but
Yeah,
it's not made up in your head. It
right.
happens in your head. So, but so it's so easy. I've had some. My son's first pediatrician was just would not listen to me about things or was acting like I didn't know what I was doing. So it was so frustrating too to like be talked to as if you couldn't possibly understand these concepts,
Oh,
and I do understand these concepts, so like explain it to me and I'll let me decide whether I can understand it or not. So fortunately I've had, like I said, I've had very good neurologists, but I've had some of my GPs have been like pretty clueless about things, you know
I don't
so
understand, how can a person with MS not have a neurologist? If it's happening in
well
your brain, then
you
don't you
should.
need a neurologist to look at it?
Yeah. Yeah, you should. Absolutely. But I just know a lot of people. Well, I don't know if it's because they don't have access to it or if their insurance won't cover it or they're afraid of the expense or if they just don't understand or their GP says, "Oh, I can do it for you." So, I
Yeah,
mean, there are some things that the general practitioners can do like, like if your kid has ADHD, most GPs can kind of treat that because it's common. So there's some
right,
things that a neurologist could be useful for, but GPs can definitely take care of it. But there's some things where it's like you really do need somebody who has a specialty because it's such a it's it's it impacts on so many levels in so
right.
many different ways and so many different things and the medications are all funky and and different ones do different things better than others. And so yeah,
Yeah,
you should have a neurologist, but
because
I think they're hard to find. Huh?
don't they have to see if the lesions are growing or expanding?
Yeah, yeah, that's you do that through an MRI usually.
Yeah.
So I mean, a general practitioner can order an MRI,
Okay.
but they won't necessarily know what they're looking at, and they won't necessarily
Oh,
know to do that kind of stuff.
Right.
So that's why a neurologist, somebody who specializes, and I'm like right now, I think my neurologist, it's MS is not really a specialty, but it's like a focus of his,
Right.
that he's had lots of patients, and he knows a lot about it. So I'm just lucky that way. But
Right.
yeah, it's very easy to get doctors who think that, and I think the other thing might be too that like some of the regular doctors just don't want to refer you. They could do it. Why are you asking for somebody who knows? I know all about it. So
Right.
I think there's just some doctors get that arrogance because they feel like being a doctor makes them special somehow.
Right.
And yeah, I understand it's life and death in their hands, all that kind of stuff, but it's you know there
Yeah.
are people who specialize, so it's
I think if I
necessary
was a
sometimes.
doctor, I'd want as much input as possible. You
Yeah,
know,
yeah,
I think I'd
yep,
want every specialist I could get to really look at this because the
yeah,
medication is so iffy. I mean,
yeah,
it depends on the person, right?
right, a lot of times,
So,
yeah,
when
yeah,
they decide that this is the medication and this is what you're going to take and that's it,
yeah,
and they don't take into account how it makes you feel or how it
right,
affects you mentally or
yep,
physically, then or emotionally, then
yeah,
they're
yeah,
not doctors. I mean,
right. They're not
you went
they're
to the
not being.
hospital a lot this summer. Can
Yeah,
you
I was
talk
there a
about
lot.
that? About
Yeah,
how you were treated?
yeah, I once again I'm fortunate, and I try to be nice. I try to be kind. I try to be pleasant, and a lot of times there's just no reason to not be. I can be salty when I need to be, but mostly so that goes a long way too. Like how I present definitely has a difference in how people treat me, but
Right.
it was a teaching hospital once again. You have these interns who come in and come out, and there's no dignity. They don't consider. I think once again, I think the doctors and nurses come in as if, they treat you as if you don't know anything about your own health, or you don't
Right.
know anything about what brings you there, or any of that kind of stuff. And so they tend to speak to you like you're just not very bright,
Right.
So I had to correct some people. And for once, one of the times I was in because I had to get a pacemaker, I was feeling like groggy all the time, and I was having real problems retrieving words and just remembering things. And so the I had to have speech therapists come in and help me, with that. And she was like, "Well, I can't tell, that you're having problems." And I said, "Well, that's good that you can't tell, but I can tell." you
Right.
know, so but that was somebody who was like willing to listen, that kind of stuff. So, the hospital I was in is a good hospital, Lutheran General. It's a very good hospital, and so they're very they just had a lot of people. They want to give you lots of services, and
Right.
that's okay,
That's
So
good.
yeah, they had some home health people come in, and didn't really need that either. But the first time they asked me about, I said I just think it's not a very good use of your resources, and
Right.
because they wanted to have somebody come in because. To help me, like it was when I had the cellulitis and I couldn't put any weight on that leg,
Right.
and they wanted to have somebody come in and help show me how to use, and I was like, I already know all that stuff because
Right.
I already use that stuff. So,
Right.
you know, so
Right. Because
some
you
of
know
it too
anyway.
was like, the people they come in kind of with preconceived notions, and they
Yeah.
aren't willing to necessarily change their views. So, but
Right.
yeah, I didn't have anybody who was really horrendously incompetent. I've
Well,
had
that's
them
good.
before, but this time it was good.
That's
So,
good. So we've had good
yeah,
and bad. So
yeah,
that's
yeah,
yeah. All right, that's our topic for this week, and
yeah.
we will see you next week.
We'll see you, yeah, before Christmas.
All
So,
right. Bye.
yeah, we'll see you then. Bye.